9 of the most popular herbal medicines in the world. Traditional herbal therapy has been used by cultures all over the world to treat illness for ages. Despite modern medical and technical advances, there remains a growing desire for herbal medicines worldwide. In fact, it's projected that this sector generates $60 billion in annual revenue. Many people prefer adopting natural therapies because they are often more accessible and affordable than conventional treatments and conform to their individual health ideals. However, you can question the efficacy of herbal remedies. Number 1. Echinacea. Coneflower, also known as echinacea, is a blooming plant and well-known herbal treatment. Native Americans have traditionally utilized this North American plant to heal a range of conditions, including wounds, burns, toothaches, sore throats, and stomach distress. Although many people think the roots have the most effect, the plant's leaves, petals, and roots can all be utilized medicinally. Echinacea can be administered topically in addition to being typically consumed as a tea or supplement. Though the data supporting this isn't all that compelling, it is now mostly used to treat or prevent the common cold. Echinacea may reduce the risk of colds by 10 to 20% when taken, according to a review of over 4,000 people, but there is scant to no evidence that it can treat colds once they have been contracted. Although there isn't enough information to assess this herb's effects over the long term, short-term use is typically regarded as safe. However, occasionally reports of side effects like nausea, stomach discomfort. Number 2. Ginseng. The medicinal herb ginseng's roots are typically dried and ground into a powder or steeped to form a tea. It is often used in traditional Chinese medicine to treat inflammation and to improve energy, immunity, and cognitive function. There are numerous types, but the two most well-known are the American and Asian forms, respectively known as Panax quinquefolius and Panax ginseng. While Asian ginseng is supposed to be more stimulating, American ginseng is thought to promote calm. Its distinctive components, known as ginsenosides, are thought to possess neuroprotective, anti-cancer, anti-diabetic, and immune-supportive characteristics, according to numerous test tube and animal studies. However, human research is necessary. Ginseng is thought to be relatively safe for short-term use, but its long-term safety is unknown. Headaches, insufficient sleep, and intestinal problems are among possible negative effects. Number 3. Ginkgo biloba. The maidenhair tree is the source of the herbal medicine ginkgo biloba, generally known as ginkgo. Ginkgo, a tree native to China, is still one of the most popular herbal supplements today. It has been used for hundreds of years in traditional Chinese medicine. It has numerous strong antioxidants, which are regarded to provide a number of advantages. The seeds and leaves are traditionally used to prepare teas and tinctures, although leaf extract is employed in the majority of contemporary applications. The uncooked fruit and toasted seeds are also relished by certain people. The seeds should only be consumed in limited amounts, if at all, due to their mild toxicity. Heart disease, dementia, mental challenges, and sexual dysfunction are just a few of the problems that ginkgo is reported to be effective in treating. Number 4. Elderberry. A traditional herbal remedy known as elderberry is normally produced from the boiled fruit of the Sambucus nigra plant. It has been used for a long time to treat constipation, colds, viral infections, toothaches, and headaches. These days, the drug is mostly promoted as a remedy for cold and flu symptoms. Although there is no established dosage for elderberry, it is accessible as a syrup or lozenge. Some people choose simmering elderberries with additional ingredients like honey and ginger to create their own syrup or tea. Although there is a lack of human research, test tube studies show that its plant components have antioxidant, antibacterial, and antiviral activities. Elderberry appears to lessen the duration of flu infections in a few small human investigations, but larger research are required to determine whether it is any more effective than standard antiviral medications. Although unripe or uncooked fruit is poisonous and can produce symptoms including nausea, vomiting, and diarrhea, short-term consumption is thought to be safe. Number 5. St. John's wort. The herb St. John's wort, SJW, is obtained from the Hypericum perforatum flower. Teas, capsules, and extracts are frequently made from the plant's tiny, yellow blossoms. SJW has been used since the time of the ancient Greeks, and in some regions of Europe, doctors continue to commonly prescribe it. In the past, it was used to promote wound healing, treat depression, sleeplessness, and numerous renal and lung conditions. Today, mild to moderate depression is primarily treated with this medication. According to numerous studies, short-term SJW use is just as effective as certain common antidepressants. There is, however, a paucity of research on long-term usefulness or safety for those who are very depressed or who are considering suicide. SJW has comparatively few side effects, however they can include allergic responses, light sensitivity, disorientation, dizziness, and dry mouth. Numerous drugs, including antidepressants, birth control, blood thinners, specific painkillers, and several cancer treatments are also affected by it. If you use any prescription drugs, talk to your doctor before using SJW because certain drug combinations can be dangerous. Number 6. Turmeric. The ginger family includes the herb known as turmeric, Curcuma longa. It has been used for thousands of years in both cooking and medicine, but only recently has its tremendous anti-inflammatory power come to light. The primary active ingredient in turmeric is curcumin. Numerous problems, such as chronic inflammation, pain, metabolic syndrome, and anxiety, may be treated by it. Numerous studies, in example, show that extra doses of curcumin are just as efficient at reducing arthritis pain as some popular anti-inflammatory drugs, such ibuprofen. Although supplements containing both turmeric and curcumin are generally regarded as safe, very high doses may cause diarrhea, headaches, or skin irritation. Number 7. Ginger. Both a common component and herbal remedy is ginger. Though its main medical forms are as a tea or pill, you can eat it fresh or dried. Ginger is a rhizome or underground stem, similar to turmeric. It has long been used in conventional and folk medicine to cure colds, nausea, migraines, and high blood pressure since it contains a number of advantageous chemicals. Its best-known contemporary application is to treat nausea brought on by pregnancy, chemotherapy, and surgical procedures. In addition, although the evidence is conflicting, research on animals and test tubes suggests potential advantages for treating and preventing diseases like cancer and heart disease. Number 8. Valerian. The blooming plant known as valerian, also referred to as nature's Valium, is said to promote calmness and peace. The dried root of valerian can be used as a supplement or steeped to produce tea. Its use dates back to ancient Greece and Rome, when people used it to treat tremors, migraines, heart palpitations, and restlessness. It is most frequently used to treat insomnia and anxiety today. However, the evidence for these uses isn't very strong. According to one analysis, valerian is slightly beneficial at promoting sleep, however many of the study findings were. Although it may have modest side effects including headaches and digestive problems, valerian is generally considered to be harmless. As a result of the possibility of additive side effects such as severe drowsiness and malaise, you shouldn't take it if you're taking any other sedatives. And the last one. Number 9. Chamomile. One of the most well-known herbal remedies in the world is chamomile, a blooming plant. The leaves can also be dried and used to produce tea, medicinal extracts, or topical compresses. The blooms are typically used to make tea, but they can also be used. For thousands of years, chamomile has been used as a treatment for upper respiratory infections, wounds, urinary tract infections, diarrhea, and constipation. This herb has more than 100 active ingredients, many of which are thought to be responsible for its various advantages. Although there is a lack of sufficient human research, numerous test tube and animal studies have shown anti-inflammatory, antibacterial, and antioxidant efficacy. However, a few tiny human studies suggest that chamomile can cure gastrointestinal issues, mental problems, premenstrual syndrome, PMS, related cramps, and osteoarthritis-related pain and inflammation. The majority of people can safely consume chamomile, but some people may experience an adverse reaction, particularly if they have allergies to daisies, ragweed,